Hey, little chocolates. Hola, chocolatitos. You see my Mexican? I'm going. Oh, Lord Jesus, I said my Mexican. Do you see my Spanish? I'm headed to Mexico soon, so I'm practicing. Anywho, welcome. Come on in. Your mama raised you right, so you know what to do. Say, hey, little chocolate back, because I love it when I hear it from you just as much. If you are watching this in the future, hey, little chocolate in the future, this applies to you too. Say hey back. It's just the right thing to do. So, tonight I am ringing the bell, okay? Kalang-a-lang-a-lang-a-lang-a-lang-a-lang, because this topic is very important. I see it coming on the horizon, and I want black women to be prepared and not get caught off guard. 2025 and black women's health. Why you cannot wait to heal. I'm talking to you, black woman. No more procrastinating. My name is Angela Billups. I am a nurse anesthetist and an integrative nutrition health coach. I help black women over 40 to heal themselves and fire their doctor ASAP. Chuck the deuces, just like that. I do this by combating the diseases that disproportionately affect our culture: high blood pressure, high blood sugar, obesity, and other manifestations of chronic stress. And we do this through culturally relevant nutrition, hello, food you want to eat, herbs, and ancestral wisdom, because they will never steer us wrong. So, if all of that sounds good to you, then here's your moment to shine, little chocolate. Hit that like button. Go ahead. Hit that subscribe button. I think that one's a little bigger. And then hit that notification bell so you don't miss any of my videos in the future or anytime where you can get to hang out with me. Awesome. While you do that, I'm literally going to sip tea. Mm-hmm. There's nothing better to me than a good cup of tea. This is peppermint. What you sipping on tonight? So, you heard the topic. I see it coming. I see it clear as day. And I don't want any of us to be caught off guard. But the truth of the matter is, the changes that have been happening even since 2024 are all pointing in the same direction and is not good for black women and our health. So, this is the part of the video where I would normally, per my coaches, Stephanie Perry and Rashida Dow, they are fabulous. They have this thing on lock, and I've absolutely learned so much from them during this challenge this week. I digress. Per them, this is a time where I would break down how conventional wisdom is wrong. But this time, it's not about conventional wisdom, it's about you. Mm-hmm. It is. It's about you and all the reasons that you have for not prioritizing your health. So let's get through some of those. I often hear from clients or from people in my DMs the same reasons over and over again. And I'm not saying they're not valid reasons, but they lead to the same results: your health not being in a good place for year after year after year after year, because we're waiting for the perfect time to get started. So, one of the biggest reasons I hear about is time. Nobody has time. Nobody has time to do anything except get through their day. And I understand that. I went through 10 years of this chronic stress, just from work to caretaking to being an entrepreneur to taking care of other people in my life that weren't my parents that I was caretaking for. Just all the things. So I truly understand. But here's the thing: that moment, that break of time that you keep waiting for to get started, even though you think you can see it on the horizon, something else is going to pop up, right? So, what we have to do is learn how to work within the pockets of time that we have. But that is one of the biggest reasons black women have for not prioritizing their health, and it breaks my heart. Another one is they are confused, right? There's so much information on social media, there's so much information on Google. You can go look for what's the best herb for high blood pressure, or can I eat this? Can I eat bananas to get silky hair? And you'll find 50 different answers for your one question. And without the expertise, how are you supposed to know which advice to follow? You have people on social media who appear to be experts, they sound very convincing, and so even they are giving you advice that isn't the best. So, how are you supposed to know what to do? Likely, the doctors aren't telling you because they don't have time to talk to you, because that, unfortunately, is the nature of the healthcare beast that we find ourselves in right now. So, confusion is also a very valid reason for people to not get started, because one thing I know as a coach is that a confused mind makes no moves. It just cannot, right? It's just kind of stuck. So we don't want you to be stuck. The next reason that I often hear from black women as to why they're not prioritizing their health is money. Look, sis, I am not the one to count your coins, okay? I don't want you counting mine. But what I do know is that a priority means it's a priority. So Maslow's hierarchy of needs talks about we have to prioritize shelter, water, food, right? Those kind of things. And if you don't have those things down, then you really can't make moves on anything else. Totally understandable if all your money's going to that. But the next level is safety. Safety means safety of your physical person, but guess what else falls on the safety level? Your health. And it makes sense because you know that if you don't have your health, you don't have anything. I don't care how many bills you have. I don't care how many people you're taking care of. I don't care how many hours you have to work at that job. If your health goes, none of the rest of it matters. So even if you haven't been prioritizing it, the minute it falls apart, it becomes the priority. And I don't want that for you. I don't want you to wait for that moment. So those are the top 3 reasons that I hear from people, even when they DM me and say, I really wish I could do these things, but I don't have the time, I don't have the money, or I'm just confused. So now that we got that out there, here's the other thing. Black women in this country, in the United States of America, have always had health disparities, right? For lots of reasons. Systemic racism has led itself to us having lower financial levels, us having lower education levels, us having lower access to quality health care, quality foods, quality public spaces, even to exercise, even if we wanted to, right? So because of that, we have always disproportionately had worse levels of health. Let me give you some stats. Black women are more than 50% of us by the age of 20 are already obese, right? 56% to be exact. In the US, black women have the highest rates of high blood pressure, about 46%. And then black women are also twice as likely to have diabetes when compared to white women. So these health disparities already existed. There were some steps being taken by government institutions, the NIH. Lots of studies have been done actually to show these healthcare disparities and lay out what's known as social determinants of health. Until recently. So the changes that have come up that are making it so important for black women to get their health all the way together is this. Starting last year in 2024, affirmative action was taken away. Now, why that may not affect you directly, right? Maybe you weren't trying to get into a university, or maybe you've been in your job for a while, you didn't have to worry about it. Here's what you have to understand. It absolutely affects the admissions into medical schools, into nursing schools, into all the schools that train the healthcare professionals that black women will have to interact with when they get into the healthcare system. Now, one of those things from the studies with the social determinants of health, what they understood was a lack of diversity in the healthcare system and healthcare practitioners led to a lack of culturally competent care. Let me explain what I mean by that. I still work as a nurse anesthetist. When I work with black patients, there are nuances that I am able to pick up on that my non-black colleagues usually don't. There are ways that I can talk to my black patients that they wouldn't dream of talking to them, or wouldn't think that that would be a way to relate to them, right? We have shared experiences. We understand each other on a much deeper level. That is the benefit of having a practitioner that looks like you, whether you're black or any other kind of minority. Having somebody who can identify with certain parts of your background, certain parts of your mindset, understand why things are the way they are, goes a long way. Well, if we are not getting admitted into the schools that train the people to take care of us, then what is going to happen to that culturally competent care? Okay? It was already lacking, but without us being trained and accepted into these programs, I foresee it's going to become more of a problem than it has been. The next thing, getting rid of programs that have anything to do with increasing the diversity and making sure people are included, are also going to do this at the professional level. I went to school at a school where there were 24 students admitted for anesthesia. There was a federal grant received by that school, and because of that, they had to have 25% minority students. They literally had 6 spots, right? That's 25% of the 24. Side note, when they tell you that they've changed to merit over diversity, equity, and inclusion, don't even believe that, because I had to vie for one of 6 spots, whereas my white colleagues got to vie for one of 18. Okay? Do the math. We have always had to do more, and this is not even 2 times more, right? Now we're talking 3 times more to even get accepted into a program where we only had 6 spots, they had 18. Those programs are gone. There's no allotment for people of color in those programs anymore, per the federal government. Okay? I'm hoping this is starting to make sense to you. So as these changes are rolling out in the federal government, they will trickle down into what healthcare looks like for Black women. Another thing that's happening, the cap on the cost of prescription drugs has been lifted, right? Last year, there was a huge win where insulin was capped at $35 for those of us who have diabetes and have to get insulin. It was capped for them. But now the cap is gone, which means the caps will also go on other medications. This is the time, Black women, to get serious about getting your health together. You see me pressing my hands? I'm begging you. Because the cost of being sick, the cost of needing to be on prescriptions, the cost of not taking care of yourself is literally about to go up. And that's just in money. The access to care, the access to culturally competent care is about to go down. We have got to heal ourselves now. Another thing, insurance, right? Under President Obama, they could no longer deny people for pre-existing conditions. I believe that is going away too. Don't quote me, but there is a high possibility of that. That's definitely been talked about. And I mean, why not, right? We're rolling everything back. It makes sense that this is something you may need to be concerned about when it comes time for open enrollment in 2026, or even re-upping your current insurance program. And lastly, I am one of the people who is looking to move abroad. I'm starting a new adventure, but even for people moving abroad, you want to think about what would be the difference in your healthcare costs at your current health level versus if you were able to maybe get off some prescriptions, maybe get into a different classification of weights. Will that save you money in the long run for your healthcare insurance when you're no longer in the US and you're abroad? So these are all reasons why we cannot wait to heal. It is time, Black women, it's time to do it now. So I am not telling you to start a low-calorie diet or to start hitting the gym 7 days a week, but I am asking that you stop procrastinating and waiting for everything to fall into place, for all the stars to align so that you can finally start to work on your health. Because the likelihood of that happening, little. All right? So I'm going to give you 5 action steps that you can start to take now so that you can actually see some changes in your health by the end of the week. Well, depending on what day you're watching this, within 7 days, let's say that. So the first one, go and see your doctor and get a baseline. Now, I'm all about teaching Black women to heal themselves and fire their doctors, but that is after you have worked with them to lessen your need for them, right? I'm not just talking about off the bat. So go to your doctor, go get the test done, get a baseline and know where you're starting at so that you have something to work toward, okay? The next thing is, if you're on any kind of medication and there is a monitor that can let you know how effective that medication is, then you need to have that at home. So, something as simple as if you're on blood pressure medication, you actually take your blood pressure at least once a week, right? I would love to see you take it once a day, but once a week is fine. Here's the thing, we can't manage what we don't measure. I work with patients all the time, right, who are on these medications for blood pressure. And we all know that blood pressure medications, even though they're very common, they can be life saving medications because of stroke. No bueno. Nobody wants that. So it's important that if you're on a medication, that you actually monitor how the medication is working and don't wait every 3 months, every 2 months, every 6 months, or however long it is in between your doctor's visits to see what your blood pressure is that day. Does that make sense? I hope I'm making sense. So you want to monitor at home. If you have diabetes or if you're pre-diabetic and you can get your hands on a continuous glucose monitor, and by get your hands on, I mean ask your doctor to write the prescription for it, then slap that thing on your arm and have an idea of how the foods you eat are actually affecting your blood sugar. It will go a long way to helping you know exactly what needs to change. So those are things you can monitor at home. Another thing, start moving 15 more minutes a day, okay? This is tip number 3. I don't know where you're starting from. You may be a total couch potato right now, and that's okay. Trust me, I have been there. I understand it. But you need to start moving at least 15 more minutes than what you already do. Now, if you are an avid exerciser and you're doing your thing 5 days a week and you're already doing at least 30 minutes of walking or movement 5 days a week, then you're good. But if you're not, start with 15 and build up to that at least 30 minutes 5 days a week. Another thing, add 1 serving of green vegetables to your meals. You can start with 1 meal per day, right? And then know that you're going to continue adding on as you're comfortable with it. Then 2 meals, then 3 meals. But just, I'm not even going to tell you to stop doing anything. I just want you to add in something more healthy. And the last thing is, sis, drink your water, right? Or, hello, drink your tea. At least 64 ounces a day. If you can get up to 80, fantastic. Drinking water is so essential for your health. Your body is over 70% water. It needs it. By the time you're thirsty, you're already 1 to 2% dehydrated. You need water to lose weight. You need water for your body's metabolism to function correctly. A lot of times when you're hungry, you're really thirsty. So sis, drink the water, okay? So those are your 5 steps that you can take that you will start to feel better within 7 days. Now, these steps will get you started. But if you're one of those women who are like, hi, yes, me, don't have time, or I'm confused, then I can definitely help you out with the Girl Heal Yourself group coaching program. This program is my baby. I absolutely love it. It is where I get to hold your hand for 8 weeks and help you put systems in place that are going to make getting healthy automatic and keep it in the forefront of your mind, okay? I want you to think about being able to have enough energy to get through your day and then still be able to work on your passions after all your obligations are done. Think about not having to hide behind people when it's time to take the group pics, being able to confidently jump out into the front, okay? This program is designed to help you get off those medications and age with intention, with less pills and pains. This is exactly what you need to start to heal. It's going to get into your mindset, help you change those deep-seated behaviors, also that you can prioritize yourself because you deserve it. So, if you're interested in that, let me give you the link here. There we go. You can get on to the wait list by clicking on that link. I'm actually going to put it in the description box below as well. But I would love to have you join me. And more than anything, I would love to have you a year from now, or actually let me ask you, where do you want to be a year from now? Do you want to be wishing that you had gotten on this and started before these other things kick in or before it becomes too expensive and just too hard to take care of yourself the way you need to? Or would you want to be celebrating the fact that you didn't wait for it to come down the pike and you got in front of it and now you're feeling better, you're looking better, and you ain't worried about what they got going on because you don't need them. You fired them, right? All right. That's what I got for you today. I would love to hear your thoughts in the comments. Let me know, are these things that you've been thinking about? Is this something that you see coming down the pike as well? Let me know what you think. See you soon.